Welcome, and thank you for joining the American Heart Association's Fireside Chat series to learn about today's topic, health equity as it relates to women. I'm Amanda Palumbo, Executive Director for the Heart Association here in Tampa Bay, and I'm honored to be joined by two panelists and experts in the space of diversity, equity, and inclusion. Dr. Jane Morgan is a longtime volunteer of the American Heart Association and currently sits on our Southeast Regional Board and our National Diversity Leadership Committee. Her full-time job is Executive Director of the COVID Task Force at Piedmont, and she's a cardiologist and also a graduate of a historically Black college and university, Spelman College. I'm also joined by Dr. Charlene Walton. She's the Director of the American Heart Association's Historically Black Colleges and Universities Scholars Program and also an anesthesiologist. Dr. Walton is also a graduate of an HBCU, Howard University. Welcome to you both.
Thank you.
Thanks for joining me today. When we talk health equity, what we mean is that everyone has a fair and just opportunity to live healthfully. We know that there's so many complex societal factors that can inhibit an individual to live a long, healthy life, such as affordable housing, healthcare, zip code, access to education, just to name a few. And so today, what we really want to talk about is women. We want to look at health equity through the lens of women and specifically minority women. What are they facing as barriers to health? And so if I can start with you, Dr. Morgan, I'd love to ask, we know that women are more prone than men to some risk factors that can cause heart disease, stroke, cancer, diabetes, and dementia. What are some of the reasons behind this?
I think what we see in women is there's a higher propensity for obesity, higher propensity for elevated cholesterol, higher propensity for hypertension. And then we also see us as caregivers of families, but then we also have additional societal burdens and stressors that are put on us as Black women, as mothers of Black sons, living within the construct of where we find ourselves in America for generations and generations. And I think, there's nothing to, you can't minimize that ongoing psychological stress and burden that is a part of someone's everyday life and everyday fabric. And I think when you add all of those things in, we certainly can understand when we talk about obesity, hypertension, high cholesterol, caregiver, and societal constructs and the stress and pressures that go along with that, then certainly we do see elevated risk factors in heart disease for African-American women.
That's such a good point. We often talk about women and mothers as being the CEO of the household. And so that stress that you talked about certainly does bear heavier on women sometimes. What about, we know that there are issues related to reproductive health that can also increase a woman's risk of cardiovascular disease. Can you talk a little bit about that?
Yeah, no, absolutely. If we look at early menarche, meaning when you started your first period, late menopause, as well as where you are when you have your first baby, what that age is, and then what is the condition in which you have your pregnancy. So for instance, do you have complications like gestational diabetes or terms such as preeclampsia, eclampsia, hypertension of pregnancy? If you've ever heard any of these terms, then you in fact do have an increased risk of cardiovascular disease. And your pregnancy, not only your pregnancy, really the pregnancy for all women, in fact serves as your very first stress test. That is the stress test on the body. And if you develop any of these conditions during pregnancy, then in fact, you have failed that stress test. After safe delivery of your baby, you certainly should follow up long-term with a cardiologist, because we know that your risk of cardiovascular disease is going to be more premature. And your first stress test has already given us that indication that your risk of heart attack, your risk of heart failure is now increased, not because of the pregnancy, but the pregnancy has now identified where you are in that risk paradigm. And we want to make certain that after the baby is delivered in a healthy fashion, that is part of your postpartum care, meaning your follow-up care, along with seeing your obstetrician gynecologist, you also make an appointment with a cardiologist. Let he or she know the condition of your pregnancy and begin to follow those guidelines and recommendations.
Such important reminders. As a new mom myself, you are speaking to me. Thank you so much for sharing that. You know, with everything we've just heard, we know women are up against a very specific set of risk factors and health risks. Yet women remain so underrepresented in research and in clinical trials. I'd love to hear you both talk a little bit about why is this so dangerous?
Well, I think it's dangerous because we're just left out. And so if research isn't done to include us, then who knows what problems we're going to have. So, you know, including women in that research effort is extremely, extremely important because we're women and we're different. So I think that's why it's so important.
Yeah, you know, absolutely. And it's even more important, I 100% agree, to make sure that women of color are in these trials. We have to ensure that data that is gathered on new medications, devices, vaccines that goes to the FDA for approval is relevant to all sectors of the population and not just relevant to white men. We've got to stop allowing drug companies, device companies, and medical hospitals to continue to practice medicine this way, where we are prescribed medications, where we are essentially naive to these medications. The first time we are ever introduced to them is following FDA approval. And that's the first time we begin to learn of our side effects when we're out in the real world, when we're at Disney World, we're on a cruise, we're at our son's baseball game. That's not the time to learn about side effects. Time to learn about side effects within your group or cohort is during the clinical trial when you're in a controlled environment, where you have access to health personnel, where people are tracking you, where the FDA is interested in your data, not when you're out on your own. And we have to begin to stop thinking about, we need to begin to think about what that means for our health, what that means for having health access, accessing the system via clinical trials, and how that narrows the gap in health equity. Incredibly important for women to participate. If that has shown us nothing else, the COVID vaccine trials have shown us how important it is for everyone to participate in this process. Our best and brightest thinking comes through clinical trials. That's our best and brightest thinking. We should not be excluded. We should not allow ourselves to be excluded.
We've talked about the fact that women are underrepresented in research. We know it must be changed. What are some of the ways that can be done? And how are you, with the Historically Black Colleges and Universities Scholars Program, helping to make that happen?
Yes, women are vastly underrepresented in medical, in clinical research careers. And so I think that one of the significant steps that has been taken by the American Heart Association. And in their Go Red for Women campaign. And then they've taken it a step further to the research Goes Red, which involves women involved in scientific medical research to come together as a group and communicate across all disciplines. So I think that just from a standpoint of bringing more women into the field and letting voices be heard is extremely significant. In regards to the HBCU Scholars Program, our program partners with HBCUs to bring students who are interested and motivated by the biomedical and health science careers to an academic experience where we connect them with American Heart Association related researchers. And they do from September to April academic research. And we also provide virtual leadership conferences. We also provide team building, and we provide services to them that will let them see that they are a necessary part of closing that healthcare and diversity gap. It has been proven that a lot of African Americans who go on to get professional degrees do go back to their communities and practice. And it absolutely makes a difference when care is being delivered by someone who looks like you, by someone who has a background similar to yours. So our program, which was founded in 2015, is experiencing expansion and growth. And so we will continue to try to increase the numbers of HBCU students in the biomedical clinical sciences to bring them into the healthcare and biomedical research areas where they are so needed and so necessary.
That's certainly such an important point. You talk a little bit about how it's not just research, it's also, in the medical field to ensure that we are having doctors that look like the patients that they serve. Can you talk to us a little bit more about how this is being accomplished and how groups maybe like the Heart Association or other groups are helping to ensure that we have more representation within the medical community?
Yes. Well, African Americans make up 13.4% of the US population, yet only 4% of physicians are African Americans. When students are accepted into medical school and go to medical school, that's only 7% of all the latest figures of the 90,000 students who are enrolled in medical school. And graduation rate, latest figures was about 20,000 for the 2018-2019 school year. Only 6% of those students were African American. So whatever anyone is doing is needed. Our program is specific and special and geared toward increasing the number of minorities who graduate and go on to professional health degrees. Not always medicine, dentistry, but they can go into dentistry, pharmacy, nursing. All of the fields need that diversity. So our specific program strives to increase the number of students being exposed to biomedical and healthcare science careers.
Well, that's such a wonderful program happening at the collegiate level. We hear so much in the community that local organizations and schools are really invested in STEM programs right now and trying to empower young girls, specifically minority girls, to pursue degrees in STEM fields. And so, would love to hear either of you talk a little bit about, it's great that it's happening at the collegiate level. Is there anything else that can be done in the community to help inspire young girls and minority girls to go into STEM fields?
I think one of the things that we have to always remember, even as we are, trying to have doors open for us, that we also have to work to mentor others. And, I had an occasion where I had a research coordinator who was working for me. She decided to go back to school to pursue her master's in public health. I supported that. But she got to the point where working a full-time job, being in school full-time, she had hit a breaking point and she was being asked to do an internship as well. And I watched her struggle with that. And, the decision would have been to quit school and not get her master's degree, or maybe quit her job and risk being homeless. And, oftentimes we're faced with those kinds of situations. And I was able to create an internship within Piedmont, within the research department, where she could help me on an independent project that I was working on in congenital heart disease. Since I was her boss, I was able to manage her schedule as well, such as she could do the internship and I could sign off on it. And it allowed her as well to stay in school. It was additional work for me, but I think it also allowed somebody else to have an opportunity where otherwise they would have fallen through the cracks. And one thing that has come back when I think about that is just recently, we worked on that paper for a couple of years. She finished her internship, she finished her master's. And just 2 weeks ago, I continued to work on that after she finished and went on and got a better position, right? With her master's degree, which is what it was all about, helping people develop themselves and build their careers. But just 2 weeks ago, we finally got that paper published in the Journal of Congenital Heart Disease. And she's the second author on that. And she was very instrumental. I probably would not have been able to get it published if I had not had a pair of extra hands. And she certainly would not have been able to an internship if someone hadn't seen her and extended a hand. And so I think we need to always consider maybe what positions we're in, no matter whether we are where we would like to be, wish we were somewhere else, we're always somewhere better than someone else, and we have an opportunity to help. And so that's sort of been a lesson I've been perseverating on for the last couple of weeks since this paper was published, that back when we started that, I didn't know where it would end. It ended up being something that came back to me as well.
Yeah. And it's persons just like Dr. Morgan who step up when they don't have to and become a mentor. And the mentor is the heart of our HBCU Scholars Program. And it's just that situation that Dr. Morgan just described, where you just stepped in and you just do. And it always works out. So Dr. Morgan is a perfect example of what we can do individually on a personal level, and also mentoring programs on a local level. Because a lot of times it just takes, as Dr. Morgan said, someone else being interested.
That is a beautiful lesson. And Dr. Morgan, I love what you said about you're always better off than someone else. And there's not always the time to do it, but if you can make the time and really impact someone's life, it can go so far.
Right.
Thanks for sharing that. Well, I'd love to ask you both at this point if there's, anything else that you'd like to share on this topic around health.
So one thing that I'll add, as I close out, we are, more than a year into this COVID pandemic. And we put on more than the freshman 15, call it the COVID 25. When we talk about weight, we've had a year of being sedentary. We've had a year of stress. We've had a year of the biggest alcohol sales in the history of the nation. We said and done, it will be interesting to really understand the true impact, the negative impact of this pandemic, certainly on our community with heart disease. So if you have been one of those who has gained weight, as most of us have, including myself, I tried my best, but I put it on. Understand that you must begin to take it off, because it puts you in a different risk factor, many people, and that risk factor increases your risk of heart disease. These are real risks. Increases your risk of diabetes, increases your risk of hypertension, increases your risk of cholesterol. So it's not just pounds and I can't fasten my pants, it's pounds and you now have increased your risk of heart disease.
Such an important reminder, and especially as I know we're talking to mothers, and that we talked before about women being the head of the household, that those healthy habits are not just you, but also trickle down to your whole family. So it's a really, really important message there. Dr. Walton, anything else that you wanted to say before we close out today?
Yeah, well, I want to say that I'm just very happy and encouraged that we are looking at women and taking a deeper dive into, what that means and how to treat and how to mentor and how to raise. And because diversity and inclusion are unique And that in order for us to get where we need to go as a society, that we really need to make sure that all voices are heard and listened to. And, I just want to say that just keep mentoring. If there's someone near you, by you, close to you, at your church, at your job, at your home, if you have the capacity to reach out and mentor someone, do it, because it takes heart to mentor. And so, I am so appreciative that programs like the HBCU Scholars Program does exist to try to close the gap that exists, because there's not enough of us in that space.
Thank you so much. Thank you both for being here today with me to talk about this really important topic. Before we close out, I do just have to give one little PSA from the American Heart Association that one of the things we're really trying to do is to empower individual women to not only take control of their own health and know their numbers, but also to participate in research. And so we have a Research Goes Red program that anyone can participate in simply by signing up online. It's free. And what it does is it enables researchers to be able to connect directly to you, to be able to participate in research projects as applicable ones come up. So a great opportunity to be a part of the solution. And again, thank you both so much for your time today. I learned so much. I really am grateful for you both, and hope we can continue this conversation.
Yes, thank you so much.
Yeah. Thank you for the opportunity.